Hello, thank you so much for joining us today. My name is Samantha Casamento. I'm part of the Longevity Income Solutions team, and I'm joined by Eliseo Tajanlangit, a registered nurse and certified case manager. Also along with us today in this Zoom call are principals Michael and Jonathan. And our plan is just to talk to Eliseo and kind of get to know his experiences that he has had as a registered nurse and a case manager, and how his experience can help us when looking for next steps in crisis. So, Eliseo, if I could just have you start by kind of explaining a little bit about yourself and telling everyone watching who you are.
Hi, my name is Eliseo Tajanlangit. I am a registered nurse and board certified case manager, as well as a licensed Medicare life and health insurance agent. I work currently at the hospital as a nurse case manager doing discharge planning.
And if you could just explain what the case manager role is in a hospital setting, because I feel like a lot of people get confused by what a case manager's role actually is. So if you could just answer that question for us.
Case managers are in the hospital are usually social workers or registered nurses. There are some overlap in what we do with discharge planning, but for the most part, the social workers lean on their training with behavioral health and substance abuse and that kind of stuff. And then the registered nurses lean heavily on their medical background, which is interpreting data and coordinating the medical issues of the patients. And both of us work on creating a safe discharge from the hospital. I have observed that a lot of the referral sources that I refer to out in the community is missing the clinical aspect of the care.
So in that last response, you mentioned safe discharge. And going off of that, what are options for people who upon discharge can't go home? So they won't be safe at home. You know, they're at a higher risk of falling, higher risk of strokes. So how do you explain options and advise their families or caregivers?
So whenever I meet them in the emergency department, that's actually a triggering event. It can go from simple to very complex. The simple being the daughter is accompanying their 90-year-old mother who needs more community resources. Therefore, I start looking for vetted community referrals, and I let the daughter, who's usually taking care of mom, know about them so that they can be supported out in the community.
That's great. And now kind of switching gears a little bit, we're going to be talking about caregivers. So I have this really great graphic from AARP that kind of gets into details about how much money caregivers can actually spend on their loved ones. So let's get into that. Okay, so like I said earlier, this graphic is pretty much about family caregivers in the US and how much money they actually provide in unpaid care. So it talks about some crazy numbers, and I was just wondering if there's anything that you specifically want to touch on, because I know you do a ton of seminars about stuff like this, and so it just might be a good thing for people to hear from your perspective and what you see in the hospital setting.
So the first one, the strain can be enormous and they put caregivers on financial and retirement security at risk. I see that all the time. I have seen, because of the longevity risk, that the 60-year-old daughters are moving back to Pennsylvania from Florida to take care of their 90-year-olds. So therefore, they have to kind of quit their jobs prematurely, and that causes a lot of strife in there, and also opportunity cost for their own retirement.
And I was just wondering if you have any additional comments that you think people watching this would have to know.
Planning is the key. And I really hope that you should look into your Medicare insurance and make sure that while you're still healthy and while you're still able to get the right Medicare insurance, that's the very basic. And second is to plan not only for yourself, but also for whoever's going to take the baton to be your power of attorney. You know, for a lack of a better word, I always hear the parents say they don't want to be a burden to their children. If you use your resources well and pre-plan, I think you can accomplish that.
Thank you, Eliseo. That was all for me, but if there are any people on mute right now who have a burning question, feel free to go off mute and ask Eliseo. John?
Hey, John.
You know, I think that you run into situations when you talk about this long-term care, but there's a lot of families that don't have that type of planning. And you're finding, you know, when they're in the hospital and they're going through this medical crisis or this health crisis, that it's at that time that a lot of these families probably need more assistance than anything else. One of the reasons you came to longevity is to give them that plan and to give them a solution on how to pay for care. And I'm just wondering, you know, what type of a scenario guidance that you run into on a more regular basis. Not Medicaid. I mean, these are people that have resources, but they don't know what to do.
I say create a team. Create a vetted team. One of the things that I see all the time is that when they're in crisis mode, in crisis planning, they tend to shut down and are very confused about all their choices. Work with somebody that's kind of comprehensive planning, like Longevity Income Solutions, to just holistically take a look at what your situation is. And it's a one-stop shop to take a look at your situation and create a customized plan.
Jumping right along, I think, Eliseo, you're bringing up a number of great points in this. And, you know, I think in this conversation is that, you know, the approach is always, you know, the Medicare nurse navigator that you say is really like, you have to understand that the quality of the insurance that you have to get the care you need when you need it right at that point is critical in all of the planning. But then once you get there, it's the remainder navigation, you know, of life. How do you go on and live through the next pieces? And it's navigating what kind of policy they have. If they have one and they're lucky enough to have bought one early on, and then whether it's a minimal benefit or it's a robust benefit, how to continue to use those benefits that they have, whatever the cost may be, to make sure that it continues to stay user-friendly in their pocket and help them understand what a valuable benefit that those assets are as a long-term care policy. And then given whatever the nature is figuring out the right approach to use and stretch and grow their assets in a safe and very well thought out plan that utilizes the expertise that you can bring into the case about the prognostication, the real longevity of this person and the trajectory with the care concerns, the impairments that they have, and being able to utilize those assets very well. Specific highlight, especially for those that have a spouse, and protecting the spouse as well, because it can be costly, whether you're going to the $8,000 to $12,000, you know, assisted living or nursing home situation, or whether you ended up being outside, you know, living in your home situation and paying $8,000, $12,000, or $15,000 to get the care in the home. You have to figure out ways. Includes tax, you know, looking at the legal pieces, looking at their finances, looking at where they have their assets and how they can stretch them to stay in the environment they want to be for as long as they want to be there.
What I offer is anytime that I'm talking about Medicare or Medicaid issues, there's no charge. You're going to need the clinical part of it to guide you for the rest of your life. And those spikes of utilization, whether it's financial or the medical piece of it, needs guidance for the rest of that client's life. And therefore, I think it behooves, you know, wealth managers and financial planners, as well as all the other community referral partners, to really partner up with somebody who can balance or kind of communicate the medical as well as the financial part of the whole process.
I think it's a huge piece, and I think it's so important that to mate and team, like you said earlier, create a team, you know, and bringing together the medical piece and the financial parts to take care of them for that long journey, and how one can give so much more guidance to support them, because it behooves people that are in charge of the finances to do a good job, go out and beyond and above the normal, just for what you need be proactive and support their clients through this very, very difficult time. It's already emotionally draining enough. It's now financially draining. And it's nice to know that you have a team behind you that can support you through this process.
What I've seen, and my tagline with this, of my role, is that because I'm currently in the hospital and seeing this in real time, what I'm telling you is the live streaming version of advanced care planning. It is almost like Groundhog's Day when the patients come in and the family members come in. I have the purview and I have the privilege to be able to kind of know exactly what they're going to say next, because I've seen it too many times. And so if I tell you and your clients and your potential clients that this is what I'm seeing right now, please think about it, 5 years from now. And if crisis planning or Medicaid planning is in your healthcare trajectory or just in your finances, it takes months to prepare for that and gather all the documents. If there is any clue that I can add on, mating the financial as well as the medical, as well as the healthcare trajectory, as well as a whole host of psychosocial issues, you should listen, because I'm seeing it every single day.
Well, that concludes today's interview with Eliseo Tajanlangit. Thank you so much, Eliseo, for joining us. We appreciate it so much. Hopefully the audience was able to benefit from some of your comments and some of our discussions that we had today. For more information on this topic and so much more, visit our website, longevityis.com, and we hope to hear from you soon.